Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Welcome to the Stem Cell Healing Institute podcast. We are here once again with Dr. Sara Figueredo. She is the director of the Institute and she is back in Guatemala. This is our second podcast with her back in Guatemala. And today we have a very interesting topic, which is multiple sclerosis. So, doctor, how are you?
Great. Thank you, Luis. Thank you for having me. Always a pleasure to do this podcast with you.
So we can say that multiple sclerosis it's autoimmune disease. So that means that the body attacks itself. Is that correct, doctor?
That's right. So with any autoimmune disease, be it multiple sclerosis, diabetes, rheumatoid arthritis, lupus, Hashimoto's, thyroiditis, so any autoimmune condition is where the body creates antibodies and attacks a specific tissue. In this case, these antibodies attack the myelin, which is the nerve, which is the sheath that surrounds the nerves of our bodies, of our peripheral nerves. And so what happens is these antibodies literally attack and degenerate the myelin that covers the nerves. And that myelin is a type of fat. It's a fatty tissue that literally allows the conduction of neuronal impulses for electrical energy to pass through to allow movement. So the nerves are what allow for movement and feeling and so on and so forth. And so when there's demyelination occurring or degeneration of the myelin sheath, that's when a person basically deteriorates in their movement, in their mobility, in the ability to use their hands and fingers or walk or whatever the case may be. Sometimes even, swallow and breathe and things like that. So, and it's devastating to patients. And so what the stem cells do is with any autoimmune condition, there's a two-pronged approach with stem cells. First of all, we want to have an effect on the immune system in order to stop the antibodies, to stop the autoimmunity, number one, so that they stop continuing the attack on the tissue, number one. Number two, we want to undo the damage that's already been done. Okay, so there's been degeneration, and what we want to do is promote regeneration with the stem cells. So those are the two parts that we need to address when we're doing a stem cell treatment. And that's the goal. And we have to do that. So that allows for a patient to go into remission and also recover deficits that they've lost in their mobility and in their lifestyle. So that's basically the approach that we want to take. And that's the goal that we have with the stem cells with a disease like multiple sclerosis.
And people may don't know this, but multiple sclerosis can cause visual disturbances and also some tremor. It may also cause sexual issues as well, right, doctor?
That's right. That's right. Because what happens, as I mentioned, the nerves are affected. So the optic nerves of the eyes, for instance, the nerves that lead into the groin area, impotence, the tremors, which are caused by the degeneration of the nerves. And so it's all nerve related because the nerves are literally sort of deteriorating. And so that's why it affects so many. And you're right. So it's not just mobility. It can be with sexual dysfunction. It can be visual. It can be chewing and swallowing. It can be even breathing. So all of these functions are supported by nerves, which can eventually deteriorate in multiple
And how do stem cells know exactly how to work on a patient that has multiple sclerosis?
Yes. Okay. So what happens is in any damaged tissue, there's a cytokine released. It's a chemical messenger that is specific for that damaged cell. So when that cell is broken and damaged, it releases a specific cytokine for that tissue. And so in this case, it's the myelin. So when the stem cells are put into the blood or into the cerebrospinal fluid or into the intranasal aspiration, which penetrates into the cribriform plate and bypasses the blood-brain barrier. Anytime these stem cells are introduced to anywhere in the body, they hone in to that specific tissue because of the cytokine that's released. So that cytokine signals to the stem cells that, hey guys, come over here. This is the tissue that needs reconstruction. And so it's quite phenomenal the way the body knows and the healing response of the body and how it can heal itself.
And this treatment will involve any physical therapy or oxygen therapy as well?
Yes, yes. So what we do, our approach is very, very comprehensive. So yes, we do a pre and post protocol of hyperbaric oxygen. So it can be in the form of a chamber, or it can be exercise with oxygen therapy. We also do a total detox of nutrition and antioxidants in an IV form, along with suppositories and B shots. And we do age dependent growth hormone therapy, as well as certain key minerals and herbs in the form of our stem cell enhancement formula that aids the body in receiving the stem cells, and it also helps the stem cells to just keep working and doing their best in renewal. Yes. And rehabilitation, absolutely. So the oxygen is involved with that, and then any other therapies that are required on an individual basis.
If we have a patient with severe symptoms, this patient can see improvements. In what period of time, doctor?
We will see results in literally within weeks, more definitely within months, because regeneration takes time. Okay, so when cells are working and doing a good job in building back what has been depleted, it takes time. So we see results typically in weeks to months, and we can continue to see results up to a couple of years. So it's quite phenomenal before the stem cells die off.
Also, the stem cells can actually last for a long time inside our bodies.
That's right. That's right. And they're called adult mesenchymal stem cells because they do die. They have a lifespan and they die after a certain number of years. Usually it can last perhaps up to 2 to 3 years. And um,
But
and that's a good thing.
they do repair the tissues that are damaged.
Absolutely, they do. And we want them to die after a certain time because we don't want continued growth and uncontrolled growths and possible tumors. And that is why we never see any risk of tumors or cancers with adult mesenchymal stem cells. And that's a risk with embryonic stem cells and fetal stem cells, which we never use at the Stem Cell Healing Institute for those controversial reasons.
So, doctor, how long will it take for a patient to be in Guatemala for this treatment?
Yes, great question, Louise. We get asked that all the time. So, and depending on the severity of the condition, we would need anywhere from 7 to 10 days to do everything that we want to do, starting with the pre-treatment protocol, which begins at home actually before they come. And then we do the stem cell treatment and continue the post-treatment up to 10 days. And then they continue the post-treatment protocol at home also. So in Guatemala, we would need them anywhere from 7 to 10 days.
Okay, so in this case, if a patient wants to book an appointment, they can do it through our website. Is that correct?
That's right. They can go directly to our website at stemxcure.com or stemcellhealinginstitute.com. And they can also reach out to us by telephone or WhatsApp at +502 4220 7297. That's +502 4220 7297. They can also reach us through our US number. It's 209 690 7836. Again, that's 209 690 7836. And they can visit us on Facebook and Instagram and check out our YouTube podcasts also.
Sure. So, if you suffer from multiple sclerosis, or you know someone that suffers from multiple sclerosis, you may refer them to this podcast, and I think that will be a good start to come to our clinic.
Yes, exactly. And also, just to reiterate something that we mentioned in most of our past podcasts is that the whole treatment package is the comprehensive treatment, and we also help with the accommodations. We provide accommodations here in Guatemala, as well as a driver and chauffeur service for all of the appointments and airport transfers and so on and so forth. And we will also help with air travel. So, with helping with booking with the best flights and so on and so forth. And we also have a lot of patients that like to come and do the tours as well as some sightseeing. So Guatemala is a great place to see the coffee farms and the volcanoes and the Mayan ruins, and it's quite a destination spot.
And I think it's important to mention that our clinic is in one of the most residential areas in Guatemala, so you may feel very secure.
Yeah, that's right. That's right, Luis. Yes, thank you for mentioning that.
So, doctor, that was a very interesting topic today, multiple sclerosis. If you want to refer to this podcast to someone you know, you may also know that this podcast is published in Spotify, and you may also find this podcast in a video format on YouTube. So, doctor, I don't know if you want to add anything to this podcast.
You know what? I think that we've covered all the bases, Louise. You've been very thorough with your questions. Thank you.
Okay, so everyone have a good night, and doctor, thank you for coming.
Thank you so much, Louise. It's always a pleasure. You have a lovely evening.
You too.